The Southern African Undersea and Hyperbaric Medical Association and the Undersea and Hyperbaric Medical Society have these indications for hyperbaric oxygen therapy: air or gas embolism, central retinal artery occlusion, selected problem wounds, carbon monoxide poisoning, clostridial myonecrosis or gas gangrene, compromised grafts and flaps, acute traumatic ischemias including crush injuries, decompression sickness, delayed radiation injuries, sudden sensorineural hearing loss, intracranial abscess, necrotizing soft tissue infections, refractory osteomyelitis, severe anemia, thermal burns, and the newest indication, avascular necrosis of the femoral head. This QR code will take you to a website where you can download a PDF produced by the UHMS with all of the references substantiating the indications that are listed by them. This document is a valuable resource with a huge amount of information. Going back to the basic physiological principles of oxygen administration, I became aware of the fact that the partial arterial oxygen pressures within the arterial bloodstream increased significantly when the atmospheric pressure was increased. The first principle of hyperbaric oxygen therapy is based on hyperoxia. Hyperbaric oxygen therapy increases the partial pressure of oxygen, leading to a greater amount of oxygen dissolved in the blood plasma, which is a key principle behind the therapy. The increased oxygen concentration in the blood creates a stronger diffusion gradient, allowing oxygen to move more effectively from the blood into tissues, particularly those that are hypoxic or ischemic. Hyperbaric oxygen therapy can help prevent reperfusion injury, a type of tissue damage that can occur when blood flow is restored to tissues after a period of oxygen deprivation. As per Boyle's law, increased pressure reduces the volume of gas bubbles in the body, which is crucial in treating conditions like decompression sickness and arterial gas embolism. Increased oxygen levels can enhance the body's natural defenses against infection by increasing the activity of immune cells, including the white cells, and inhibiting the growth of some bacteria. The vasoconstrictive effect of hyperoxia can reduce tissue edema, which is beneficial in conditions like crush injuries and burns. Hyperbaric oxygen therapy promotes angiogenesis, or the formation of new blood vessels, and stimulates the production of growth factors like vascular endothelial growth factor and platelet-derived growth factor, which are essential for wound healing and tissue repair. Air embolism is a condition caused by gas bubbles in the bloodstream. In case of accumulation of large amounts of gas in the arteries due to trauma or surgery, these bubbles can stop the blood flow, thus causing a lack of oxygen, which results in cell death. Air embolism is an acute condition, and hyperbaric oxygen therapy is considered a primary treatment modality. Gas emboli can result from penetrating injury of the lung or accidental intravenous air injection of air during some surgical procedures, for instance, open cardiothoracic surgery. Patients could present with loss of consciousness, confusion, neurological deficits, cardiac dysrhythmias, or cardiac arrest. The treatment with hyperbaric oxygen therapy relies on hyperoxia, when blood becomes oxygen-rich and when increased pressure causes a bubble to decrease in size and volume. This leads to a rapid elimination of bubbles out of the lungs. Because of the fact that this condition is life-threatening, the patients are exposed to 2 sessions per day, and the total sessions depend on the patient's clinical response. The treatment time, especially for the first treatment, is decided by the hyperbaric physician based on the presenting symptoms and clinical response. Carbon monoxide poisoning occurs due to inhalation of carbon monoxide. It binds to hemoglobin to form carboxyhemoglobin, which is toxic and deprives cells from oxygen. Hyperbaric oxygen therapy is considered a primary treatment type for this acute condition. Patients are exposed to 2 sessions per day, and a total of 5 sessions can be done based on the patient's clinical response. Inhalation of small amounts of carbon monoxide over a long duration or a large amount over a short period can occur. The patient can present with flu-like symptoms such as headache, visual changes, dizziness, and nausea. Loss of consciousness, seizures and chest pain, ECG changes, tachycardia, and acidosis indicate excessive exposure. The treatment with hyperbaric oxygen therapy relies on hyperoxia. Oxygen displaces the carbon monoxide, and the gradient of elimination is faster with hyperbaric oxygen therapy. Decompression sickness, also known as diver's disease or the bends, is a condition arising from dissolved gases coming out of the solution in body fluids and forming gas bubbles, specifically nitrogen bubbles, inside the body upon depressurization. Decompression sickness is an acute condition where hyperbaric oxygen therapy is considered a primary treatment modality. Daily sessions are done for the decompression, and the total sessions depend on the patient's clinical response. The session duration is also determined based on the symptoms and clinical response. The major cause of decompression sickness is because of bubbles that evolve from inert gas dissolved in blood or tissues when atmospheric pressure decreases too rapidly while ascending after scuba diving, or ascending rapidly while flying in unpressurized aircraft. The symptoms are indicated on this diagram. The treatment with hyperbaric oxygen therapy depends on hyperoxia, as well as the decrease in the size of the bubbles in the patient's circulation. These bubbles are rapidly eliminated out of the body through the lungs. Gas gangrene or clostridial myonecrosis is a bacterial infection of muscle which results in gas production in the affected tissues and tissue death. Gas gangrene is an acute condition, and hyperbaric oxygen therapy is considered a supportive treatment modality. The cause of gas gangrene is due to infection of the skin and muscle following trauma or surgery. The causative organisms are usually bacteria belonging to the Clostridial species. The patient can present with moderate to severe pain with progressive swelling around the area of skin injury. The skin can become pale and later changing to a dark or purple color. Vesicle formation can occur with blisters filled with brown-red fluid, and drainage of fluid can occur with a foul-smelling odor from the fluid. There can be air bubbles or subcutaneous emphysema felt underneath the surface of the skin. The patient can present with an increased heart rate as well as a fever. The use of hyperbaric oxygen therapy in the treatment of gas gangrene relies on hyperoxia, angiogenesis or the formation of new blood vessels, improved or enhanced white cell activity, and enhanced antibiotic activity, where the organisms are killed by the presence of high oxygen concentration. Necrotizing fasciitis is a rare but severe type of bacterial infection that can destroy skin, underlying tissue, and fascia, but it spares muscles. Necrosis refers to the process of cell death that occurs because of this infection. Necrotizing fasciitis is an acute condition, and hyperbaric oxygen therapy is considered a supportive treatment modality. 1 or 2 sessions can be done per day depending on the severity of the patient's illness. The total number of sessions depend on the patient's clinical response, but usually resolves within 10 sessions. The duration of a session is usually 90 minutes of 2.5 atmospheres absolute with 100% oxygen. The cause of necrotizing fasciitis involves bacteria that's caused by Streptococcus pyogenes and other so-called flesh-eating bacteria. The symptoms could be significant infection with small, reddish, painful spots or bumps underneath the surface of the skin, accompanied by severe fever, sweating, chills, nausea, dizziness, profound weakness, and finally shock. The use of hyperbaric oxygen therapy in the treatment of patients with necrotizing fasciitis relies on hyperoxia, enhanced white cell activity, and enhanced antibiotic activity because of the increased oxygen pressures. Burns caused by different thermal or chemical agents affect different layers of the skin, underlying tissue, and even muscles. Based on the depth of the thermal injury, burns are divided into first, second, and third degree burns. Hyperbaric oxygen therapy can be used within the context of first and second degree burns without surgery, and in addition to surgery for third degree burns. Acute thermal burns would be considered an acute condition, and the use of hyperbaric oxygen therapy would be considered a supportive treatment modality. Patients are usually exposed to one session of hyperbaric oxygen therapy per day, up to 10 sessions in total. The cause of the thermal burn can be due to fire, flame, steam, hot liquids, or other heating devices. Could also be caused by chemicals, radiation, or even electricity. The symptoms would be based on the extent of the injury, and this would be divided between first, second, and third degree burns depending on the depth of the injury. The use of hyperbaric oxygen therapy within the context of the treatment of thermal burns relies on hyperoxia, angiogenesis, and the reduction of tissue edema caused by hyperbaric oxygen therapy. Compromised skin grafts and flaps represent a classical problem involving insufficient oxygen supply to the tissue. Hyperbaric oxygen therapy increases oxygenation, reduces edema, and initiates angiogenesis, or the formation of new blood vessel. Compromised flaps and skin grafts would be considered an acute condition. Hyperbaric oxygen therapy can be used as a supportive treatment modality. Patients are exposed to one session per day, and the total number of sessions would be based on the patient's clinical response, up to approximately 10 sessions. The cause of the compromised flaps and skin grafts would be tissue defects and after injuries or complicated wounds or surgery. The symptoms would result in devitalized and compromised blood supply with discoloration of the skin and or flap. The use of hyperbaric oxygen therapy within the context of compromised flaps and skin grafts would rely on hyperoxia, angiogenesis, and reduction of tissue edema. Crash injuries usually represent a range of conditions resulting from direct or indirect trauma. Crash injuries usually involve only superficial tissues, however, when severe, may involve muscles, tendons, and even bone. Crash injuries and acute trauma ischemic injury would be considered an acute condition. The use of hyperbaric oxygen therapy within the context of this problem could be considered supportive. Patients are usually exposed to one session a day, and the majority of patients would be treated up to the extent of the patient's clinical response up to 10 sessions. The cause could be direct trauma, and the blood supply to the tissue or the organ could be affected, thereby leading to poor injury. The symptoms could include pain, failure to heal, and severe edema, especially in the context of compartment syndrome. The use of hyperbaric oxygen therapy within the context of a crash injury or acute traumatic ischemic injury would rely on hyperoxia, reduction of edema, and angiogenesis, or the formation of new blood vessels. A brain abscess results from a bacterial infection within the brain, leading to the formation of a single or multiple pus pockets. Multiple inaccessible brain abscesses can be managed by hyperbaric oxygen therapy. An intracranial abscess or abscesses would be considered an acute condition. The use of hyperbaric oxygen therapy within the context of this condition would be considered supportive in addition to antibiotics and/or surgery. Patients would be exposed to 1 to 2 sessions per day, and the total number of sessions would be based on the patient's clinical response. The cause of intracranial abscess would rely on infection from neighboring structures or spread of infection from the blood itself. The patient could present with symptoms including fever, headache, and focal neurological deficit, with symptoms such as seizures, fits, etc. The use of hyperbaric oxygen therapy within the context of intracranial abscesses would rely on immunomodulation or the enhancement of white blood cell activity, enhanced antibiotic activity, the so-called post-antibiotic effect, angiogenesis, new formation of new blood vessels, and the reduction in edema within the brain itself. Acute anemia resulting from severe blood loss decreases the total oxygen carrying capacity. Lack of oxygen causes various systemic symptoms and may result in acute heart failure. Acute blood loss anemia is considered an acute condition. The use of hyperbaric oxygen therapy is considered a supportive treatment modality. The cause of the acute blood loss anemia could be because of blood loss or hemolysis. The symptoms would include fatigue, dizziness, nausea, gastrointestinal dysfunction, weakness, tachycardia, hypertension, chest pain, increased respiratory effort, rapid onset of fever, and evidence of blood loss either externally or internally. The use of hyperbaric oxygen therapy within the context of acute blood loss anemia relies on hyperoxia, where the increase in oxygen concentration in the blood facilitates maintenance of the patient's hemostasis up to the point that the patient can respond to other treatment modalities. These patients are exposed to 2 sessions of hyperbaric oxygen therapy per day, and the response will determine how many sessions the patient would have. The retinal artery supplies oxygen-rich blood to the eye and the retinal layer of the eye. Due to an obstruction of blood flow caused by a blood clot or an embolism, sudden painless loss of vision can occur. Central retinal artery occlusion is considered an acute condition, and the use of hyperbaric oxygen therapy could be considered supportive. The cause is often that of an obstruction of the artery by a thromboembolic event, and this leads to blockage of the central retinal artery. The symptoms would include a sudden, painless, unilateral loss of vision. The use of hyperbaric oxygen therapy within the context of central retinal artery occlusion relies on hyperoxia. Because of the increased concentration of oxygen in the blood, a partial return of vision could be expected. The patient is exposed to 1 session per day, and the total number of treatments is dependent on the patient's clinical response, usually between 5 to 10 sessions. Sudden sensorineural hearing loss, commonly known as sudden deafness, is an unexplained rapid loss of hearing either all at once or over a few days. This happens because there is something wrong with the sensory organs in the inner ear. Sudden deafness frequently affects only one ear. Acute sensorineural hearing loss is considered an acute condition. The use of hyperbaric oxygen therapy is considered supportive. The cause is usually unexplained, and the symptoms include a sudden, painless, unilateral loss of hearing. The use of hyperbaric oxygen therapy within the context of treatment of sensorineural hearing loss relies on hyperoxia, reduction in edema, and reduction in inflammation. Patients are usually exposed to 1 session of treatment per day. Based on the patient's clinical response, up to 10 sessions would be justified. Vascular insufficiency of the femur head due to disturbed intraosseous microcirculation could contribute to avascular necrosis of the femur head. The prolonged ischemia can result in osteonecrosis. Avascular necrosis of the femoral head is considered a chronic condition. The use of hyperbaric oxygen therapy is considered supportive. The cause of avascular necrosis could be idiopathic due to previous trauma or dislocation, embolism, decompression, and various medical conditions. The symptoms include asymptomatic, or the patient could develop hip or groin pain and can even develop a spontaneous fracture. The use of hyperbaric oxygen therapy within the context of avascular necrosis of the femoral head relies on hyperoxia, new vascularization, reduction in edema, and reduction in inflammation. Patients are usually exposed to 1 session per day. The patient's total number of treatment depends on the patient's clinical response, usually involves 20 to 30 sessions. Osteomyelitis is an infection of bone or bone marrow, usually caused by bacteria. Refractory osteomyelitis is defined as chronic osteomyelitis that persists or recurs after appropriate antibiotic treatment and surgical interventions have been performed. Refractory osteomyelitis is considered a chronic condition. The use of hyperbaric oxygen therapy is considered a supportive treatment modality. The cause of refractory osteomyelitis can be because of infections following trauma, fracture repair, spread of infection from a distant site in the body, or other sources. Causative organisms include Staphylococcus aureus, Streptococcus pyogenes, Haemophilus influenzae, Salmonella, etc. The patients could present with pain, fever, swelling, localized redness, an open wound with drainage of pus, formation of a tract from the bone to the skin. The treatment of hyperbaric oxygen therapy in the context of refractory osteomyelitis relies on hyperoxia, the formation of osteoblasts and osteoclast stimulation, as well as enhanced white cell activity. The patients are usually treated once a day. The total number of sessions would be determined by the patient's clinical response, which could be up to 30 sessions. Delayed radiation complications are typically seen after a latent period after the radiation exposure. Often, delayed injuries are precipitated by an additional tissue insult, such as surgery within the radiation field. Delayed radiation injuries are called osteoradionecrosis when it involves the bony tissue, and soft tissue radionecrosis when it involves the skin, muscles, and other soft tissues. Delayed radiation injury is considered a chronic condition. The use of hyperbaric oxygen therapy is considered a supportive treatment modality. The cause of radiation injury is because of radiation of a field with an additional insult like surgery, which then compromises the blood supply, leading to necrosis. The symptoms could include pain, non-healing wounds, or other symptoms dependent on the irradiated field. The use of hyperbaric oxygen therapy within the context of radiation injury relies on hyperoxia, as well as the formation of new blood vessels, also known as angiogenesis. Complex wounds are defined as wounds that have not improved over a period of 30 days in spite of intensive wound care. These wounds do not follow the normal path of healing due to a number of local and/or systemic factors, especially ischemia or hypoxia, lack of oxygen. Complex wounds are considered a chronic condition. The use of hyperbaric oxygen therapy is considered an advanced wound care modality and a supportive treatment modality. The cause of complex wounds would include multiple local and systemic factors that may lead to hypoxia, and this could result in a non-healing wound. The symptoms would include devitalized tissue and compromised blood supply with increased pain. The use of hyperbaric oxygen therapy within the context of complex wounds would rely on hyperoxia, angiogenesis, reduction in swelling and redness around the wound, enhanced antibiotic activity, and the stimulation of the formation of new cells. Patients would be exposed to 1 session per day. The total number of treatments would depend on the patient's response to treatment.